Welcome back. You're watching SA Today here on SABC News. Stats SA will tomorrow release the economic growth figures for the first 3 months of this year. The consensus among economists is that the first quarter GDP figures will show that the economy grew by well over 3%, powered by growth in mining output, which is being fueled by a strong recovery in the global economy. All right, let's move on then. We're going to be talking to teacher union Naptosa. Workers in South Africa's education sector will not receive their vaccines this week. That's because the United States medicines regulator, the Food and Drug Administration, or FDA, has not yet given the go-ahead for Johnson&Johnson jabs to be released. Teachers union Naptosa says the rollout was expected to start on Wednesday. We're now joined by Naptosa's Basil and Manuel. Mr. Manuel, always a pleasure to see you. Thank you for joining us here on SABC News, sir.
Absolute pleasure to be with you. Good afternoon.
So let's start by talking about the feedback that you received that then obviously had to stall the plans to get that vaccination drive started on Wednesday. We're obviously hearing there were some issues then with the J&J vaccine. Talk us through that and what the plans are thereafter.
On Friday afternoon, we had a meeting with the DDG, and where the unions as a collective were informed about the vaccine availability, the 500,000, but of course contingent on the FDA, the Food and Drug Administration, approving its release and its then arrival in the country, which we were expecting to happen over the weekend or today, and then the rollout to start by Wednesday, Thursday. Sadly, of course, there seems to be a delay, but we hope that given this limited window period, that we would still have it, and probably by the weekend, and that we could still roll it out in the 2 weeks and a bit that we would have left thereafter. It's going to be a massive undertaking, and we know that there are logistics that have to be attended to. But it's such an opportunity for the education sector to get in and get the vaccine that we didn't want to miss this opportunity.
Yeah, I understand, of course, that there will be a delay, but let's also just backtrack a little more. In fact, Mr. Manuel, the union, of course, Naptosa, saying that 500,000 J&J vaccines had then been secured. Talk to us about the process of you being able to secure that many vaccines, and if you had been able to count whether or not there would actually be sufficient to be able to administer to whether it is the teachers or support staff at the many schools here in the country.
Remember that from last year, Naptosa, together with the other teacher unions, mind you, have been making representation about the teachers being vaccinated. Yeah. And that was heightened by the whole debate of the third wave and the primary school children going back. And so the advocacy and advocating around that had been happening a lot. Pressure, letters to the minister, letters to the Minister of Health, and of course the Minister of Education coming out in support of it. But then many other groups also supporting the call for educators as a frontline group to be secured. Of course, the 500,000 and the vaccines had little to do with the unions directly. The opportunity became available, and we are not directly in contact with that, but we were contacted to say this has become available and we would be the next in line. Of course, as a collective of unions, Naptosa included, we were elated by the news. And of course, we then had to start talking to the department about logistics. And 500,000 covers the 420,000 teachers. And remember, a lot of teachers have already received the vaccines. Those that are over 60 have already started. But if you also look at the fact that we're looking at the age group 40 and above, then that already excludes a number of younger teachers that would fall into another batch. And then, of course, we said it's not about teachers only. It's about the entire education sector, because people working at school, whether they be clerical staff or ground staff or cleaning staff, they are also part of the people that need to be protected. And the estimate has been that if you look at the public schools, that 500,000 ought to cover it. So to start with the public schools, go on to the private schools next. And of course, we hope that even if there are people that fall below the age of 40 but have comorbidities, that there would be sufficient to cover them too. And there's no exact number. Because we don't know it is such a rush. We don't know the precise number that we need, given that it's, of course, a free choice, and that there may be some people that may not want to, although we as Naptosa are certainly saying, please, here's a golden opportunity, don't let this slip you by.
It seems like you anticipated my next question, Mr. Manuel. I was actually going to talk about, those teachers or support staff who simply actually don't want to take the jab. I'd been reading some reports that said that, there might be some institutions or some places of employment who, in fact, force you to take the vaccine and can rightly, institute disciplinary hearings to you if you refuse to take that vaccine, if they put it down as something that's the core of the way that they do business or how they do business, as something that you have to do. And I wonder if that's something that might, be implemented at schools. And just on the back of that too, in terms of the fact that this particular vaccine, the J&J vaccine, hasn't really been authorized, and now you've had to have this delay, might that also be, adding to those who are perhaps a little bit skeptical to take the vaccine in the first place?
The skeptics will always be with us. But let me remind you that when we did the first survey as a group of teachers, teacher unions, 58% of those that were asked for their opinion indicated that they would be ready to take the vaccine. We have just completed another round of surveys, and we will be releasing results from tomorrow. And preliminary results show that more than 75% of our teacher core is now saying they will take the vaccine. But that is not the full story, because of the other 25%, a good 15% is saying we are not sure. So the number of people that will eventually take it is much higher than we had originally anticipated. Now, I'd like to believe that this is a trend within the country where some group takes it, and of course it encourages another group. And this is what we hope will happen with teachers. With teachers taking it, the broader community will also feel encouraged to do likewise, because they would then see that a group that is in touch with the community has done that. However, we are worried about people who don't want to take it. We are worried about, for example, teachers and support staff who have comorbidities. Whilst we haven't discussed this yet, what does happen to somebody with comorbidities who doesn't want to take the vaccine? Can you still be off? Can you be expected to be off with pay? And these are questions that we're going to have to cross when we speak with the Department of Education as employer. These, I'm sure, are things that they're thinking about already.
Yeah. All right, Mr. Manuel, always a pleasure. Thank you for giving us that information. I'll certainly be catching up with you when you do indeed start that rollout as planned. We'll certainly need more information as to where you are with that vaccination drive of teachers and support staff. Thank you.